Welcome. Today, we're going to explore cognitive behavioral therapy, often known as CBT. It's a widely recognized and effective form of psychotherapy. CBT helps people understand the connections between their thoughts, feelings, and behaviors. It's a practical approach focused on the present. The goal is to equip you with tools to manage challenges. It's about learning new ways to cope and thrive in your daily life. At the heart of CBT is a simple yet profound idea. Our thoughts, feelings, and behaviors are all interconnected. They constantly influence one another. Imagine a triangle. One corner is thoughts, another is feelings, and the third is behaviors. A change in one area impacts the others. For example, a negative thought can lead to an unpleasant feeling, which might then lead to an unhelpful behavior. This cycle can become self-reinforcing. CBT helps us identify these patterns. We learn to break unhelpful cycles and create more positive ones. The cognitive part of CBT focuses on our thoughts. We all have automatic thoughts that pop into our minds throughout the day. Some of these thoughts can be unhelpful or distorted. They might be overly critical, catastrophic, or based on assumptions rather than facts. In CBT, we learn to identify these unhelpful thought patterns. We call them cognitive distortions. Examples include all-or-nothing thinking or overgeneralization. Once identified, we don't just accept them. We learn to question and challenge them. Is this thought truly accurate? Is there another way to look at this situation? This process is called cognitive restructuring. It's about developing more balanced and realistic ways of thinking. It helps reduce emotional distress. The behavioral part of CBT looks at our actions. Our behaviors are often a response to our thoughts and feelings. Sometimes, we engage in behaviors that, while providing short-term relief, are unhelpful in the long run. Avoiding situations, for instance, can reinforce anxiety. CBT helps us identify these unhelpful behaviors. We then work on gradually changing them to more adaptive and constructive actions. This might involve behavioral experiments. You might test out a new behavior to see if your feared outcome actually occurs. Behavioral activation is another key technique. It encourages engaging in activities that bring pleasure or a sense of accomplishment, even when you don't feel like it. By changing our behaviors, we can often change our thoughts and feelings too. It's a powerful way to break negative cycles. CBT offers a toolkit of practical strategies. Cognitive restructuring, as mentioned, helps us reframe unhelpful thoughts. Problem-solving skills are also central. We learn to break down overwhelming problems into smaller, manageable steps. Exposure therapy, often used for anxiety disorders, involves gradually facing feared situations in a safe and controlled way. This helps reduce avoidance. Mindfulness techniques can also be integrated. They teach us to observe our thoughts and feelings without judgment, fostering greater awareness. These techniques are not just theoretical. They are practical exercises you can apply in your daily life. CBT is a collaborative therapy. You and your therapist work together as a team. It's not about the therapist telling you what to do. It's a structured approach. Sessions often have a clear agenda and focus on specific goals you want to achieve. CBT is also goal-oriented. You'll identify specific problems and work towards measurable improvements. It's typically a time-limited therapy. The aim is to equip you with skills you can use independently, rather than fostering long-term dependence. The focus is on teaching you to be your own therapist. You learn to apply the principles and techniques yourself. CBT is highly effective for a wide range of conditions. It's a first-line treatment for many mental health challenges. It's commonly used for depression, anxiety disorders like panic disorder and social anxiety, and obsessive-compulsive disorder. CBT also helps with post-traumatic stress disorder, eating disorders, and chronic pain management. Even for everyday stress or relationship issues, CBT principles can provide valuable insights and coping strategies. It's a versatile approach that can be adapted to individual needs and circumstances. During CBT sessions, you'll actively participate. You'll discuss your thoughts, feelings, and behaviors related to your challenges. A key component of CBT is homework. This involves practicing the skills and techniques learned in therapy between sessions. Homework might include keeping a thought record, trying out new behaviors, or practicing relaxation techniques. This practice is crucial. It helps you integrate the new skills into your daily life and reinforces learning. Your therapist will provide guidance and support, but your active engagement is vital for success. One of the greatest benefits of CBT is that it teaches you lasting skills. You gain tools you can use long after therapy ends. It empowers you to understand and manage your own emotional responses. You become more resilient in the face of life's challenges. CBT helps you develop a more balanced perspective. It reduces the impact of unhelpful thinking patterns. It fosters a sense of control and self-efficacy. You learn that you have the power to change how you think, feel, and behave. Cognitive behavioral therapy is a powerful and practical approach to improving mental well-being. It's about understanding the intricate dance between your thoughts, feelings, and actions. By learning to identify and modify unhelpful patterns, you can create positive change. It's a journey towards greater self-awareness and effective coping. Remember, you have the capacity to learn and grow. CBT provides a clear path to building a more fulfilling and balanced life.